Good afternoon and welcome to the first Webinar Wednesday of 2023 in this our 9th year of offering up-to-date and informative webinars to the HTM industry. Today we are joined by Ty Greenhalgh, Healthcare Industry Principal with Medigate by Claroty, and Mike Luessi, GM Global Healthcare and Life Sciences Industry Business at ServiceNow. Webinar Wednesday would like to thank our sponsor, Medigate by Claroty and ServiceNow. Medigate by Claroty is the industry's first and leading dedicated healthcare IoT security platform, enabling healthcare providers to safely deliver connected care. Medigate fuses its deep understanding of medical workflows and proprietary protocols with the reality of today's cybersecurity threats, so hospitals can confidently connect and operate all clinical assets on their network while ensuring patient privacy and safety. To learn more, visit claroty.com. Just a quick reminder to save the date for our spring MD Expo. We're headed to the Woodlands Waterway Marriott Hotel and Convention Center in Houston, Texas, from April the 11th to the 13th. Join us for 3 days of education, networking, and the latest advances in medical technology products and services. Registration is now open, so for more details, please visit mdexposhow.com. Today's webinar is eligible for 1 CE credit from the ACI. You can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We will wrap up today's presentation with a live Q&A, so please submit any questions anytime using the questions feature on the webinar dashboard. Okay, let's kick off today's webinar by giving away one of our Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. January is National Blood Donor Month. What is the most common blood type? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. As I mentioned earlier, Ty Greenhalgh and Mike Luessi are our presenters today, and they will be discussing, left to our own devices, will we implement best practices? Ty, you may begin whenever you're ready.
Well, thank you. What a great intro. Yes, I'm looking forward to going down to Houston for MD Expo as well. So look forward to seeing everybody down there. Today we're going to be talking about the title here, left to our own devices. So, given we are responsible for solving the issues at hand with respect to the cybersecurity of medical devices, are we going to follow what the best practice recommendations are? I mean, people are putting them out there, and are we going to follow them? And so, can we follow them? So we're going to talk a little bit about that and what the challenges are there, and what type of opportunities there are to move forward in this space and start providing better cybersecurity and patient safety within our ecosystem. So kind of with that, I'll introduce myself first. I've been in healthcare for about 30 years. I'm, like she said, industry principal for healthcare at Medigate by Claroty. And I'm also a member of the 405D group, which we're going to be talking a little bit more about today, which has supported HHS in putting out the best practices for medical device cybersecurity, which we're going to be talking a little bit about later. So that's a little bit about me, and I'll turn it over to Mike. Can you tell us a little bit about yourself?
All right, thanks, Ty, and hello, everyone. Looking forward to this session. So Mike Luessi, I lead the healthcare and life sciences space at ServiceNow. I've spent probably the last 25, 30 years in a number of different areas, but I love this topic. This topic is super interesting. It's super complex, and there's a lot of other devices and industries that had to figure this out over time as those devices became more attractive to people that wanted to do terrible things. And so I think today is hopefully going to be super informative, and look forward to any of the questions at the end, but I'll pass it back to you, Ty.
Thank you. So kind of what we're going to talk about today is a quick backstory, why hackers love healthcare. We have a wicked problem at hand, and what that is. The Department of Health and Human Services have developed some best practices and why they're important. why and what are the new opportunities, and what does Medigate and ServiceNow look like? But then end it with some unexpected business value that a lot of people don't understand is just there, ready to be leveraged. So that's kind of the overview we're going to go through. So the quick backstory, just looking in the rearview mirror real quick, the American Recovery and Reinvestment Act really basically through meaningful use required us to put in an electronic medical record, which has just a tremendous amount of benefits. But it really put a lot of data online very quickly, as well as medical devices being hooked up to the network, and created a very efficient, effective, improved patient care. But we didn't really think through the whole cybersecurity aspect of things. And so these devices, the medical devices, they're connected to the network. There's, lots and lots and lots of vulnerabilities per device. They don't talk in regular network protocols, so they can't really be managed by traditional IT technology, security technology, because they are OT devices. And our government is just figuring this out now. I think that President Biden, in a recent directive, made the point to say that we need to be taking a look at the OT environment and not just IT. And the FDA actually came out and said, we have this a fundamentally new problem is the OT operational technology versus IT, because it requires a whole different set of security solutions and approaches. And this presentation won't go into all the reasons why, but they are different. And now we've struggled with it for so long that the government has now stepped up and said, well, we're going to have to step in and make something happen. So Mike and I both feel very strongly that the industry is at an inflection point. So hackers love healthcare. Well, we'll just kind of run through these. I always say that 89.74372% of all statistics are made up, but when you get the average of charts and they're all going in the wrong direction, it does tend to tell a story. And so no matter how you look at it, healthcare is the #1 target for 11 years running. The hackers love us. We have the most lucrative record, and we pay because of patients involved and healthcare involved, the patient lives. And also the method is now moving more towards network servers and system intrusion for a method of attacking. So these medical devices that are on the network are actually entry points into the network. A recent Ponemon Institute study, what was the root cause of your data breach? And I thought it was very interesting here that the respondents, I think there was 517 respondents from hospitals across the United States, said that it's 12% said it was an IoT device and 9% said it was a medical device. And so those are not traditional IT devices that the hackers are coming in through. And from a perspective of patient safety and patient outcomes, it just makes sense that these devices, when an organization is hacked, whether it be ransomware, disruption to service, disruption to technology, that the staff is going to be doing less. They don't have the tools to provide the same level of care for a maximum number of patients. And so, but I was surprised with the number of 23% of the respondents said that it was actually impacting the mortality rates. So, this is it's a big problem. Also, CISA came out with a study here recently that does a correlation between ICU beds when they're overloaded and how it affects mortality. And the correlation then is ransomware also has the same type of impact on an institution, that it overloads the system and therefore would also have an impact on mortality. So just strong correlations there, and something to think about. The Joint Commission has stepped in, and by directive of the CMS, due to an investigation done by the OIG, that they realized that they're not doing anything on this topic, and so they are now formed a committee, the Joint Commission has formed a committee to add to their audit, and they will be conducting that most likely starting this year. But my question is, do checklists promote compliance or security? So is it, what is this really going to have a huge impact other than motivating hospitals to do something? What will it motivate them to do? And will it be because they're trying to avoid fines, or are they going to be offered incentives like meaningful use because the government sees it such a big problem? So there's there's a lot going on, and there's a gentleman named Bruce Schneider who wrote a book called "Click Here to Kill Everybody," and in it he describes a wicked problem as being a problem that is so complex, so intricate, and is so difficult to get your head around the problem and just understand the problem, let alone try to come up with the solution. And that's what I think we have here. So Gartner has approached this in the method of saying there's a life cycle journey of cybersecurity here, and they broke it down over different device types. And the IT, pretty mature. We've been doing this for a while. We got a lot of security tools out there for that. But the medical devices and the building management systems are much more in their infancy because they're different. I said they're different protocols. They need to be treated different. They need different solutions to help manage them. And they're more in their infancy of just trying to visibility on the network, just even trying to find them and see the thousands of devices and what they're actually doing on the network. So it's a problem that we don't, and a lot of hospitals don't even know what all the devices on their network are. And you can't start managing the problem of securing the devices if you don't know that they're there. And so a whole of nation effort has been created to address this. And we're trying on all sorts of different fronts. FDA's updated their guidance. They even tried to put in through their user fee upgrade some medical device security initiatives that got stripped out. They were pretty much pulled from the Patch Act, which ended up being put in the Omnibus bill and Section 3305, which is really the vulnerability disclosures, patching, and the SBOM. That's just been added. That was just signed at the end of December. So there's some requirements on the medical device manufacturers to kind of step up to the plate. Now, how they're going to do that, I think, is going to be a challenge. It's not all crystal clear. So we're going to have to work through that. Senator Warner has put out a security and patient safety questionnaire. Really, here are 17 policies to consider. What's your opinion? And basic cyber hygiene, incentives, changing HIPAA, updating HIPAA, just a lot of them. That's a really good read there. And the White House is right. From my understanding, they're about to release some directives. Now, what that's going to mean, I don't know yet, but it's going to be directed to healthcare medical devices, and so we can look at that. And also the health industry cybersecurity practices, we call that HICCUP, part of the 405D group. That's been around for about 2 years, these best practices. It's being upgraded, it's been updated, it should be released this month. So I would imagine sometime in early January, you'll be able to see that. And those best practices, the HICCUP by the 405D, were based on identifying the 5 top threats and 10 best mitigations. There's a group of 250 healthcare experts across the country, along with HHS and a number of vendors and just specialists, and all got together and said, what are the best practices? And they broke it down into small medium and large facilities, and every different practices and sub-practices based on the level of complexity of the organization. And you can find that document at 405d.hhs.gov. And the medical device cybersecurity practice basically says you need to do endpoint protection, identity access management, asset management, network management, vulnerability management, security operations, procurement. So these are all things that need to be done. But the caveat is this is broken out. This is different than IT. This is for medical devices and needs to be done differently. Kind of today, we're going to be focusing on the asset management piece. Why is the asset management piece important? And from my perspective, it's the very first thing that needs to occur. You have to get an accurate inventory. The NIST cybersecurity framework says the same thing. HICCUP says the same thing. CIS says the same thing. Now, all these frameworks, the first thing is an accurate inventory of your hardware and software. Without it, you don't know what to protect. You don't know what your risks are. Everything else is really immaterial. So that's why we're focusing on asset management, because it's so foundational. And in the new, this is a snapshot of the new version that's about to be released. And I just wanted to highlight this one section for the asset management piece. And if you see the circled areas, it says it's recommending that you have a CMMS, and it's integrated with an automated asset discovery tool like Medigate. It's the only way you're going to be able to get your hands around the complexity and the breadth and the depth of this problem. And so I look forward to this coming out and everybody downloading a copy and reading it to help with your insomnia. The government feels so strongly about this particular document that they have created a law that says, mimic to high tech, that for these recognized security practices, of which what we just reviewed was one of two, that this recognized security practice, if you will demonstrate that you've used them for 12 months, if you've had a breach, they will reduce your fines, decrease your audits, and reduce post-breach oversight. And the two recognized security practices are the NIST cybersecurity framework and the 405D document that I was just referring to. So they really want you to do that, to the point where they've actually just came out with a 30-minute advisory on how to do that. By Nick Heasters. So kind of with all that teed up, I know it's a complex, it's a wicked problem, and it's going to take all of us working together and coming up with new solutions and new tools. And so kind of with that, Mike, I'll put it over to you. What do you think about the information that we just covered, your comments and your thoughts, and what y'all are hearing over at ServiceNow?
Yeah, it's super fascinating. I'll throw a question to you. So if you think about do you know what the value of a social security number is these days on the black market?
Well, I do. I think it's around 50 cents. And when I sell them, I mean, I'm sure.
Yeah, 50 cents. And what's the value of a regular medical record not totally complete? Any idea?
I hear ranges of $500 to $1,000.
Yeah. So somewhere $250 to $500 on the base level ones and $1,000 on the most complete medical record. And if you think about why, remember the saying when they asked the question, why do you rob banks? And the answer was, that's where the money is. It's the same thing here, which is, and I'll share something from a Chime session that I was recently in, meeting with CIOs and CTOs and others on this topic. Very few of them are concerned that the main thing that somebody wants to get after is actually turning off a device that's going to impact somebody, their life, or like the care that they're receiving. They're worried that these devices become launch pads to steal the medical records. And so you may ask, why is a medical record so valuable? Once you have a complete medical record, you can use it to fill prescriptions. You can use the medical record to submit false claims to the insurance companies for reimbursement. There's all these things that somebody can do once they get onto these devices and then launch into the rest of the organization. And I started my career working in managed services long time ago. And I remember every holiday, without fail, I could guarantee that somebody was going to go and put something on the network and try to take everything down. And those things kind of worked its way from the network and the servers to end user devices. Then they worked their way probably 10 years ago into control networks. So like the big systems running distribution centers. And now we've worked our way to these devices. And these devices, what we hear from our customers and what you see on this page is customers are, how do you try to protect them? They say, I don't even know what I own. I have no idea which assets are nearing their warranty expiration. I don't know which things are being used, which ones are actually not patched. I don't even know the history of these things. And so there's a couple elements that fit in together here. There's the first part is, how do you secure it? And we don't know how to secure it because we don't even know what we have. If you go and talk to a procurement team, and I know, probably some of the folks on the call today may not be coming from procurement, but procurement says, I know we buy too much of everything because we don't know what we own. And so I think there's a lot of these pieces that come together is, if you think about an organization, and all of you that are on the call, if you think about how your organization has to do this today, this sits all over the place. And this sits in spreadsheets, it sits in a few different tools. Nobody has a complete view of what they have, what they should have, what's the current state of that device, and is it really living up to what it needs to do to provide care? And is it also a threat vector that somebody may try to take advantage of and get in the organization? And so I think what we saw together between our two organizations is an opportunity to help our customers that have used us historically in a number of different ways to bring these things together to give somebody a complete view to solve the problems, right? Reduce the security risks, improve the capital allocations that are going on here, and make sure that the devices are available for care delivery. Next slide, Ty. So I'll just throw a few more numbers out there. So there's anywhere between usually 18 to 25 devices in a hospital room. It says it costs between $4,000 to $5,000 per bed per year in lost and stolen equipment. If you remember the beginning of the pandemic, what was the question everybody was trying to figure out? How many ventilators, right? And it wasn't because there wasn't necessarily a shortage at first. People just didn't know what they had, and they were running everywhere trying to figure out. And we know nurses love to hide equipment, right? They have their favorite piece of gear, they put it back in a certain area. And so all these things kind of add up to lots of problems, which is where it says hospitals misplace or lose 10 to 20% of the equipment. $5 billion is wasted annually from expired, lost, or uncaptured medical devices. All of these things translate back into cost. Those costs have to be transferred back over, and those costs are working their way back to all of us on this call with the insurance that we have to pay. So there's a lot of good beyond protecting the devices, but also just being good about the capital that's going on and making sure that we're not wasting either things as it's related to budget or securing things. Next slide. So when we've looked at these pieces, and where a lot of this conversation is focused on today, is really around security and compliance. And we know, like, if you're doing strong security and compliance, it means that you've actually inventoried everything. Like, you can't secure it if you don't know what you have. And so protecting the medical financial data, improving compliance, and then the integrity of the device is where, from a Medigate and a ServiceNow piece coming together, we've put a lot of emphasis, and we've been working on this relationship for more than a year now, as we've been bringing the best of our two pieces of our solutions together to make it easier for our customers. You want to advance the slide? So I know, Ty, when you and I were preparing for this, we talked about, as we're recording this, we're day 4 of the new year. And it's many times fun to think about the opportunities that are in front of us. And I know from my personal background working on some of the other devices historically, as this threat vector got bigger, wow, the importance of the job that I had also got bigger. And I think that for the the audience that's with us today on here, it's really exciting about the future. I know we've talked about a lot of the risks that's here, but I mean, there's a tremendous opportunity. I don't know if you want to dive into that in a little more detail. Yeah, you want to build this out?
Sure.
And we'll talk through this for a second, and then I know you're gonna kind of dive a little bit in more detail around these items. So if you think about what it takes to do full asset lifecycle management, right? And each one of you on this call may do a portion of it, or you may have a peer that does something else in another part of the organization, but you're all dependent. This is hard to do. Like, it really is. That's why it has not been done well historically. From the idea on the left of asset inventory to deploying the asset to servicing the asset and decommissioning the asset, going back to the regulations that you talked about, like, this needs to be done flawlessly in the future. And so it's every one of these items, and you think of the subcategories that go with it, this isn't going to be able to be done in spreadsheets. This isn't going to be done with like one small little niche solution that's trying to solve the one piece, but nobody else in the organization has visibility into the full piece. And so I'd encourage all of you on the call, as you look at this, screen capture this. I know you'll get some of the content later on, but for each and every one of you, part of the opportunity in your future is to play a bigger role across this entire lifecycle management spectrum.
So I thought I would just touch on what just occurred with the Omnibus bill. And it has a section in there, 3305, that is requiring an SBOM. It talked about patches and updating, and there's some responsibilities, vulnerability disclosures. It's all a lot of good stuff that's going to be required by the medical device manufacturers. And timelines are a little vague, but it's a great way for the government to have stepped in and said, look, okay, so we've all been trying to do this, but now we're going to do it. But in that, the SBOM, the software bill of materials, is a necessary component that all hospitals are going to need. And the reason being is, when you look at a medical device, we can say, our organization, or if you go look it up online, I guess, you can see, oh, does this device have any vulnerabilities? And what are the risks to it from a cybersecurity perspective? But you don't necessarily know about the components in it and what the risk and vulnerabilities of the components inside are. So by the manufacturers having to provide a SBOM, the organizations would be provided with the contents of each device as well. So if one of the contents were to become vulnerable, then you theoretically could determine which of the medical devices had that component. So it's a necessary component, but by itself, it is possibly just more noise, more data in an already very confusing environment. And so what I want to make clear here is that the SBOM in and of itself is not going to solve the problem. It is not a panacea, as one of my colleagues calls it. And it requires a few more things. One is a vulnerability exploitability exchange. And that's basically another database that says, okay, well, the components that are in that particular device are affected or not affected. And so there's an additional layer of knowledge that needs to be weighed against the SBOM. Otherwise, you'll end up with just a tremendous amount of false positives, and everybody there that's trying to manage vulnerabilities and risks on this webinar will just go crazy with false positives and trying to track down things that aren't necessarily a problem. So also, ServiceNow and Medigate, we ingest these tools, and match them up against the device inventory that we have discovered and we have correlated between our two organizations. Then we take all of that information and run it through our vulnerability and risk, network management, threat detection, device management, lifecycle management, and operational intelligence components within the Medigate system, which if you can, you'll see there the HICP or hiccup, those are the mitigations that we align to in the best practices. So these are all the best practices that we're taking, not only the device discovery information that we get when we put our device online and we discover it, and we can then tell all the risks, but then if you import in the SBOM, we're also going to be able to tell all of the components and, that are in the device and apply all of these functions to the components for resilience, because you're going to need cyber resilience and operational resilience, because it's all about resilience now. It's not a matter of when you're going to get attacked, or if you're going to get attacked, it's when. And so, or when you're going to have vulnerabilities, and you're going to need to pivot quickly. You're going to need to know what the devices are. You're going to need to make changes. You're going to need to dispatch network engineers to put in new access control lists, or you're going to need to change passwords, or you're going to need to operationalize the data, and that's where ServiceNow comes in. And so what we did was we partnered with ServiceNow and created a service graph connector, which is the most sophisticated interface that ServiceNow has. And so we spent a tremendous amount of time doing this. And what does that mean to you? Is that when we hook the two things together, it works easily. And the reconciliation of all the data of tens or hundreds of thousands of devices with hundreds of data fields is seamless. So it was a huge investment on our part, but we did it because it was the only way that it was really going to work, because this would be a point of failure for clients. It's struggle, not so much failure, but struggle, and we wanted to remove that. So the service graph connector is a huge advance in integration. And so what we derive out of that is the ability to align our modules with ServiceNow's modules. And you can see the vulnerability and risk are correlated with ServiceNow's vulnerability and response, and our threat detection with their security operations, and then the network management and device management with their CMDB and their EAM tools, whereas with the lifecycle and operational intelligence, more with basic inventory asset on ITOM and CMMS. So there's a very sophisticated level of integration going on here, which is then put forth to operationalize everything. Because just having all this data, having all the risk data, again, it's like having all that SBOM data. What are you going to do with it? Well, you've got to operationalize it in an intelligent way. So our ability to create digital workflows through ServiceNow, where we're actually providing what the mitigation is. You can see that down at the bottom there. You can't read it, but it's the mitigation. This is what you're going to need to do. And this is one of those things where Mike was talking about, where there's additional steps and different opportunities for individuals to learn more about cybersecurity, where you may not know about cybersecurity, but here's a step-by-step on how to go about mitigating the problem. Maybe it's just changing a password. Maybe it's closing a port. Maybe it's whatever it is. And then you can assign that to the appropriate person. And then the monitoring of the devices so that you can maximize uptime, because we get utilization data, which we're going to talk more about in a minute. And then assigning the work orders automatically, getting all of those out there, and maintenance and risk management. So operationalizing all this into workflows to achieve that. And just kind of running down a quick. Yeah,
Ty, I'll just throw out there is that, between your organization and my organization, we have thousands of customers that where, for the attendees on the call today, what you get is a lot of knowledge that we've built up over time. I can promise you there's probably 4,000 hospitals around the world that manage all the other assets with us. And we've been expanding into this, and we've taken a lot of their challenges and fed that into what needed to be done here well, and what needs to be done in a way that does not overwhelm the team that starts doing this. What you don't want to do is just start tracking everything, inventorying all of this, and then you have no way to remediate it, because at that point, now you have liability issues that go along with it because you can't resolve the problems yet you're aware of the problems. And just one last part that goes with it is from my organization, we have hundreds of medical device customers that also use our technology. And so beyond everything that Ty just described, there's a way then to extend between what our two organizations are doing to feed that information back into the medical device manufacturers' systems, and to help them get smarter and more predictive around where there are risks and where there is predictive things that they can start seeing to understand failures and other things. And so we have a much broader vision here that says we'll solve a number of these parts, but we're going to get better and better over time for all of you. So I know you want to talk through some of the benefits here, but I think it's, that's a unique level of kind of integration, and the folks that are attending get the benefit from all the others that have gone before them.
Yeah, I think that's a great point to make, because we're really all on the same side. We've got to come together on this and share information where we can. And so that's a great point. As I said earlier, the Service Graph Connector, really kind of a first step, getting a contextual view of the devices across the entire life. The maintenance piece, I'm particularly drawn to doing preventative maintenance, because you can see the metrics and the utilization of the data or the devices. You can then start managing the maintenance on a preventative basis instead of just corrective and or scheduled. And so a lot of organizations are using it for to manage into their AEM programs. From a procurement perspective, you're able to say, okay, well, this new device we're bringing on, let's take the Medigate tool and say, well, what's the risk of the new device? Let's do a risk assessment on it compared to the devices we have, and are we willing to take on those new risks? And if we do, when we onboard it, let's go ahead and schedule something in ServiceNow so that we know that when it's onboarded, it's automatically going to have the controls put on it before it gets put on the network, so we're not bringing on any more risk into the environment, because otherwise you got a hole in your rowboat and you're just bailing water and you're not trying to plug the hole. You've got to stop the risk from coming in at the same time you're trying to get it out of your system. And then obviously we all know about the making sure that you deal with devices that have PII or PHI responsibly at retirement. And we know, because we can see the devices that transfer the data, which devices have ePHI. And then the utilization management for capital planning and service contracts, we're going to go into a little more detail on that, because that is the unexpected business value. So what a lot of people don't understand is that when Medigate goes and reads the packets of information that are traveling across the network that are proprietary, we actually have written parsers to open up those packets and read them. And that's for almost all devices now. And where the competition, they do machine learning and AI, and they do a little bit of deep packet inspection on IT devices and imaging devices, because it does DICOM and HL7. But the unique protocols for the manufacturers, we read all those. And that's one reason we can do such wonderful, and we're the best at device identification. But we also get utilization data, very accurate utilization data. And what organizations have found, they bought the product for security, and it does a great job at that. But then what they're finding is that there are huge benefits, financial benefits, to acquiring a system and a solution like ServiceNow and Medigate. One is that you know where all your devices are. So you think about just all the operations that go on, and the time spent trying to find devices, or the time spent trying to research a vulnerability, or an FDA recall, or reconciling a CMMS. So there's all of these things that are greatly reduced or eliminated. And so, but that's kind of a soft dollar, and it's always difficult to sell to management to say, hey, well, we're going to be more efficient, therefore you need to buy this. So what we've done is we've put together, we've probably got like 15 use cases now where different areas that hospitals are benefiting in, and these are real world hospitals that are 10% reduction in inventory costs. This was the numbers are staggering. And you don't really think about this from a security tool, or, well, we have enough of these devices. The utilization rate is low enough. If they go down, we could just use a different one. We could get by for 2 or 3 days. Why do we have 24-hour maintenance on this? Let's knock it down to a lower tier in service and save billions of dollars. This hospital particularly has saved so much money using the tool to manage devices more effectively now. They've actually opened up a department, and they're sharing dashboards. Here is another example of a hospital for utilization of underutilized devices. They needed to buy a CT scanner. They looked around their health system and said, well, this hospital has could operate with one less than they have, and because we could just the utilization rates on them and the time they're utilized, we could manage this. So we'll save $2 million and put it on a truck and shift it over to the other hospital. So these are real world savings. And so when we run this through our calculator in our business value assessment tool, even with the year deployment, say, okay, we're not going to start counting any returns for a year. It's really within a year you've got your break even, and it's really kind of sky's the limit on. And this is for just a 1,200 bed hospital, and it's not too hard to imagine that if you've got hundreds of millions of dollars of devices, assets that aren't being managed efficiently, that by managing them efficiently, you could increase the utilization of those devices and therefore increase the return on them. So with that, Mike, I think that there's just a tremendous future for what we're doing, for the people on this call. There's a huge role for them to play, and how does ServiceNow see that?
Yeah, I always, when we work on the solutions and when we think about where the market goes, we tend to also kind of think through things in horizons, like the now and now through the next year, 3 years out, 5 years out. And one of the things I'd throw out there for everybody watching this is, think about how you're doing this today in the four walls of your hospital and how hard it is to do it right there. And now as you look, and I run a global business and I get to see all around the world how these things are taking shape. I can tell you, like, the things that we're talking about on this call today are not a US only problem. They're a global problem. Everybody has this. If you were down in Australia a couple of years ago when they had all the wildfires, one of the things that came out after that was they had no inventory of everything that they had. So they had no idea what they lost. And so if you look and say, once it's being done in the four walls of the hospital, and it's challenging to do that, if we know that care continues to move into a hybrid model, home in the hospital, and that it's well documented that care becomes less expensive in the home, that has been taking shape for quite some time, and it is rolling out everywhere from what we see. And it will continue that path over the next 3, 5, 10 years. And so the way we've looked at this is, how are our customers going to be successful moving into that model when they're struggling to operate in the model that they have today? And so what I laid out there for all of you is to think about your function, your business, the opportunity that Ty talked about in the beginning, and say that if there's going to be more people that need care, there's going to be more devices, and those devices will play a more critical role in delivering care. And there's going to be people providing care in different settings than they were in before. And this is going to happen across many locations. Do you have what you need to be successful to move forward into that future model? And what we've heard from our customers as we put on that one slide with all the different questions in there is the resounding answer has been no, we don't feel prepared. And so hopefully what you saw in the presentation today is government's moving along and making more and more regulations. We have collectively looked between our two organizations, say, what have we seen? What do we know best practices are? And how do you pre-wire these things together to make it easier for customers? And that they give you the foundation that you need to not only be successful in the four walls of your hospital, but to give you the flexibility to go into new business arrangements where you are bringing care out to the home. I think that's really a super exciting opportunity for each and every one of you. Comes with a lot of risk if you don't get it right. But hopefully what you saw today is we've been ahead of this for all of you and have put together some really slick solutions. So Ty, I'll hand it back to you.
Yeah, I'm really excited. It's an exciting time, and I think that was actually a really good summary. I don't think they need to go through this whole slide, but you know, the government's stepping in. They're going to make something happen. It's always better if we do it ourselves, and it's not a checklist. Don't forget the High Tech Act that's out there that offers, if you do the things, do these things, and Medigate does them for medical device cybersecurity. If you have a breach related to a medical device, then you'll be considered for no fines, fees, or post-breach oversight, which is just huge in my point of view. The Joint Commission is going to be doing something, so watch out for that. When you hear all the things you hear about in SBOM, just remember that we've been working for a long time to figure out, for years now. Back when it was INTIA. For those of you who know what INTIA was, we've been working with this for years. So we're ready to adjust that SBOM as it matures from the medical device manufacturers. And you're going to get a single database, visibility, reduced risk. There's just so much that you get from the integration with ServiceNow and Medigate, operationalizing all of this data on a single inventory. But the kind of the one that it stands out for me, because we go through these processes, these sales processes, and we're working with hospitals, and it's a tough environment. We don't have any money. We don't have any money, and it's very difficult to say, okay, I want a security tool. Or I want an asset. I want a new clinical management system, clinical device management system, and but we don't have the money for that. But when you look at the capabilities of additional revenue, because of the data that we're able to acquire, that's never been able to be acquired before, the hospitals never had it before. Now that they've got this data, they can then start managing the devices in a more efficient way to actually generate more revenue, save money, reduce inventory. So we've put together a program where if anyone wants, we'll just come in and do like an estimate, what a return would look like for you, and where you are in alignment to the new High Tech Act, the law with respect to all of the sub practices. Where are you with that? If you had a breach and you needed to go to OCR and say, hey, we're in compliance, where are you on that maturity curve? So we think that there is a change of perspective. We're trying to help organizations find a path forward. I know that Senator Warner, he's out there trying to find a path forward on incentives and how do you pay for this. So this is a different way to look at it, and we're finding that our clients out there through through just the data that we're able to provide and then operationalize are able to pay for the systems quite quickly. So with that, I guess we'll turn it back over and look forward to some questions.
Thank you so much, Ty and Mike. We've got a few questions here that we can get through. The first question we have got is, when will the new 405D HICP update be released?
Okay, so it should have been released in December, and the FDA and HHS wanted to make sure that they got everything right, and so there was some discussions on terms, and it was scheduled for release in December and should be released anytime now in January.
Okay, great. And how about this one? How can ServiceNow and Medigate help to bring my clinical engineering, IT, and InfoSec departments together around this problem?
Yeah, that's a great question. Maybe I'll start with it, Ty. That's the that question there is part of if you think about historically where ServiceNow is sat in many of these organizations, it's already embedded doing a lot of the things for the other devices. And so this is a natural way to have the conversation around, and we're always happy to play a role in that too, and bringing everybody to the table to say, how do we figure this out? Like, we understand the problem. How do we tie all these pieces together to make this stuff work? I know when I was at the Chime session and we had the focus group with a lot of CIO, CTOs, their big challenge was, I have no visibility. I have no visibility, yet people are asking me to attest to certain things around security, or the CISO is asking me to provide some type of level of clarity on that, and they don't have it. And so it's hopefully what you saw in this presentation is we've been doing this for quite some time. We can absolutely help provide a framework for you to think through, and then bring everybody together to come up with a plan that's going to where you need to be. Ty, what would you add?
Well, I agree with everything you just said, and I would just add that what we're seeing is we go into these hospitals, and so often it's departments that have not necessarily worked together before, and so that's change. They don't necessarily understand the challenges and the value that each other brings or are faced with. And so what we're able to do is to come in and get everybody in the same room and say, look, okay, so here's a single platform with which clinical engineering can look at all the benefits that you get. You get an inventory of all your devices, very accurate. And you get to know the operating systems, and you get to know the versions, and you get to know, just a tremendous amount of detail on those devices, so that you and where they're located, and so there's just a tremendous, and the utilization data, right? There's just all this data. So clinical engineering is, oh, this is great, and in the same platform, the same system, the network engineers in IT they realize that they can baseline the communications of the devices, and in doing that, we can then create ACLs. Basically, here's all the things that these devices should talk to, and that's it. And we create code, and we send that over to the network software, which then locks those devices down. Which it doesn't sound like maybe that's a lot to a clinical engineer, but to the network security team, that's huge, because it's so much work, and everything's changing all the time. So it makes their life so much easier. And then over here for the information security people, they get all the risk and the vulnerability data. They get the SBOM coming in, and it's all on the same system. Everybody's agreeing that it's the same set of devices, and so and all of this again shared through Medigate and ServiceNow, and that no matter where you're looking, it's all the same data being shared, and everybody is getting something out of it. And so they start working together and appreciating why the other departments need what they need, and ultimately they start working together. It's I've seen it over and over again.
It also, Ty, I just want to add, because you'd said shared, it still provides the autonomy that each one of these teams needs. So I think the key word is shared visibility, like all these pieces go together, where we've seen others in the past fail on certain things is when one team tries to take over everything, and it just doesn't work. And so giving it where teams have their autonomy, but they do have a common place and allow for workflows that go across that, and it can be really run more like a production line of all the activities. That's where you have success, because people aren't worried that somebody's trying to move their cheese.
Great point.
Okay, we've got time for about one more question, and that one is, how do I get more information on the ROI maturity journey assessment?
Well, you can email me at my email there, tygg@claroty.com, or any of your regional directors, or really just ask anybody if you're in contact with somebody at Claroty. Even if you're already a client, please feel free to let us know that that's something that you're interested in, and we'd be happy to do that for you. But if you just email me, let me know that you'd like more information on that, I will make sure someone follows up with you.
And I know, Ty, that within my team, kind of working between our two organizations, we've also had within ServiceNow, there's a group called our value assessment team. They've been working through some calculators and other things that go with it. What we've seen is it's not hard to justify. Like once you get full visibility of not only the threats that you're facing by not doing this right, procurement, like my guess is procurement's not on this call, but I could tell you the majority of the ones that have wanted to move first on like certain areas to roll something out, procurement's always in the front of this, and that should speak volumes to, there are people that if you said I can do a better job of managing this, they probably have their own assessment done already. You just may not have spoken to them. And so I think we can kind of collectively help on that.
Yeah, I think that's as we talk about clinical engineering and IT and security coming together, I would throw procurement in there too. And as you're evaluating these type of tools, in compliance, and get the representatives that might be even tangential to something like this to have some benefit, that will see benefits, so that they can understand what their benefits would be, and you can get an even broader based support for consideration on something like this for your organization.
Yeah, you don't have to go it alone. We put a lot of thought into this, and we're happy to provide you details, and then you guys can kind of work through figuring it out, but we'll help along the way.
Yep.
That's great. Thank you so much, Ty and Mike, for your time today and for a great and really informative presentation. I'd like to encourage everyone to visit today's sponsor to learn more about the products they provide to our industry. So please visit claroty.com. As promised, the answer to today's trivia question is O positive. So congratulations to our winner, John Parsons. Also, a quick reminder that you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of the webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back soon with another webinar, so please visit webinarwednesday.live for more details and complimentary registration. Thank you once again for your time again. Enjoy the rest of your day, and we'll see you another time.
Thank you.